This was a long journey to get to mind-eye connection. My husband tirelessly searched the internet trying to find me some kind of a cure, some kind of a help for this injury. And with that, we came across many different doctors. We did neurofeedback. I've done, as I said, physical therapy, speech therapy, concussion doctors, neurologists, and none of them were helping. And so my husband came across Mind-Eye Connection through the internet and through the Ghost in My Brain book, which brought us here. And so we traveled from Silver Spring, Maryland to see Dr. Zelinsky.
We have a wonderful team. Dr. Wright, Dr. Yoon, Dr. Nast, and I together each have different emphasis in optometry. And we have a Swithin David, whose background is in cognitive science as well as visual rehabilitation. We have Martha David, Kathy Aldana. Our team is growing, and our mission is to help people understand that 2020 should be left in the 20th century.
In the past, both with ophthalmologists, neuro-optometrists, and with the neurologist, I repeatedly kept saying, you know, there's something to do with my eyes. I keep having something, I'm telling you that there's something connected with my eyes. And I was repeatedly told that we understand, but your eyes themselves are fine. Or I was told that, I'm so sorry, but you have post-concussion syndrome. And either I was told I have to learn to deal with this, or we can try other medications. And here I did, the exams were dramatically different, and the answers that I was given were different. I feel so hopeful.
Here at the Mind-Eye Connection, we believe in treating the whole patient. We will take the time to understand your actual issues and concerns, even if you may not think that they may be associated with your visual functioning. We hope that when you leave here, you have a comprehensive understanding of how your ocular health and your visual functioning affects your whole body and your being and your ability to function in your daily life.
We have been coming to the Mind-Eye Connections for about a year now, and yes, everybody sees improvement in basically all of his functions, but what it's allowed him to do is to relearn where his body is in space, and so he can coordinate movements, and now is able to spend his time working on higher level functions.
The role of the Mind-Eye Connection is to expand on what traditional optometry has usually done, which is make sure that you have clear central eyesight, that 20/20. Actually, in the Mind-Eye Connection, we use different treatments such as lenses or any sort of rehabilitation to make sure that your body is capable of dealing with its environment. And that way, your mind is freed up to use its full potential.
I started wearing the glasses back in June of 2015. Before I had the glasses, I could not tell where sounds were coming from. I live in a wooded area, and it bothered me that when there were birds, I couldn't tell you where the sounds were coming from. Now that I have the glasses, I'm able to start to localize. I can tell where sounds are coming from. I have a long ways to go, but it's a start. I've calmed down. I'm not as anxious. It is very difficult to go to a grocery store, but with my glasses, I'm starting to be able to tolerate going and buying a few items, where before the glasses, I really was not. So I feel like little by little, my boundaries are expanding, and I feel blessed.
We've always had patients from many different locations because I work a lot with autism and genetic disorders and brain injuries. But ever since the Ghost in My Brain book has come out, we've now been inundated with concussion patients who've had no help. They go to their eye doctors and say something's wrong. The eye doctors tell them they see 20/20, so they don't need any glasses. They come here and we say, you're right, you see 20/20, but that's for non-moving targets, and your problem is with moving targets. So here's a pair of glasses that address that problem. And then their symptoms get better.
I think patients choose the mind-eye connection because they've been around to a lot of different places looking for some kind of relief or some kind of insight into what they're going through. And it's not just a, well, let's try this approach or try this approach. It's there's a mind-eye connection approach grounded in a philosophy that Dr. Zelinsky has created that tries to address into the actual problem. I would say that the mind-eye connection is successful on almost a miraculous level, and I probably am not the only person who thinks that. There's some patients who come in and have had some severe symptoms for a very long time, and the only thing that they can attribute any kind of real change to is Dr. Zelinsky's glasses.
Well, the new research shows that the eye is not just used for seeing, and typically eye doctors look at eye health and eyesight, but the eye is so much more. It's an entry point to the nervous system. So what we're looking for is what glasses can be used to affect the nervous system on the inside as well as eyesight on the outside, rather than just the eyesight. The testing here is an eye test to make sure your eyes are healthy, make sure they see, make sure that you have depth perception, color vision, standard eye test. And then on top of that is a mind-eye test, where we test you watching moving targets and then you moving through space. The interesting thing with Asperger's and autistic patients is that they don't perceive their environment the same way that others do. And studies show it's because their eyes and ears are not in sync with each other. So one of the other things we do here is use my patented Z-Bell test in order to link their eyes and ears to make them aware of the environment in a more comfortable way.
I tried several of the different alternative practitioners who worked with eyes, and gradually they gave up on me, or I gave up on them, because whatever it was that they were offering me didn't seem to fix or address the problem. I was surprised to find out that not only was there an issue with my ability to read, which of course was up close, but I was told that the difficulty with my eyes was that my distance looking or perceiving was way too sharp, and that there was an important aspect of eye care that involved my learning to use my peripheral vision more effectively. I found my way to Dr. Zelinsky's practice. I liked what they talked about in the literature and on the website, and I decided I would give it one more try. In going and visiting her, I was delighted to find out that she was not a sole practitioner, but she employed several other people with other expertise that supported both the diagnostic process and then the healing process. And I could see gradually I was better able to do reading. I'm more comfortable in general looking out at the world and being out in the world. And Dr. Zelinsky just told me on our last visit that my left eye is nearly perfect and my right eye is on its way to being better. And she wants me not to wear my distance glasses at this point, which is a great surprise.
I enjoy working at the Mind-Eye Connection because I enjoy seeing how Dr. Zelinsky has helped several patients all around the world. It's amazing to see how they first started to where they are now with all the treatment that Dr. Zelinsky has offered all these patients. So that is very amazing.
I really love working at the Mind-Eye Connection because at the end of the day, I get to go home knowing that in some way, shape, or form, I've helped people. I constantly hear people on the phone just saying how they're so close to giving up hope. And thanks to Dr. Zelinsky's work and the mind-eye connection, they're able to not only see that there is a future, but work towards that.
I read the book, A Ghost in My Brain, that was recommended by a very close friend, and it had a profound impact on me. It was the first time that I realized there was another option, a totally different way of viewing my injury and dealing with it. And it was honestly jaw-dropping for me. And I had my husband read it, and he walked in to the room after reading a couple of chapters, and he said, "When are we going to Chicago?" And we came.